Hello and thank you for watching this short video about exercises you can do at home whilst you're waiting for your total hip replacement. We're very aware that you've been waiting for your surgery and may not have been as active during the pandemic because of the lockdowns, and we feel that these exercises could benefit you while you wait for your operation. It's very important to keep exercising while you're waiting because good movement and strong muscles will improve your outcome after surgery. There are many benefits to exercise, and these can include improved movement. If you don't straighten your knee fully before the operation, it might not be possible to get it fully straight afterwards. Better strength, better mobility, and even benefits to your general fitness, and in some instances, some pain relief. Careful management of your overall health is important, including managing your weight, stopping smoking, having good control of your blood pressure and diabetes, because it all helps reduce complications after your operation. Whilst we know that you're likely to experience some pain, it is still safe for you to complete these gentle exercises, ensuring that you are in the best possible condition before your knee replacement. It's important that you take enough pain relief to allow you to exercise and maintain your movement and strength around the knee. Pain relief might involve taking tablets or using ice or heat or even a combination of these. When you exercise, it's important to build this up gradually and be consistent with your activity. Most people feel it's better to exercise a little regularly rather than a lot in one go and being too sore to exercise the next day. Pain can be affected by many things in your life, and we can be more sensitive to pain if we're tired or even stressed. Making sure that you give yourself time to rest and relax can help you manage your pain. A good sleep routine can help too, and this might involve a regular bedtime, limited screen time in the evenings, and reducing caffeine. Regular exercise and activity in the daytime can also help your body feel tired and ready for sleep. So the first exercise is called the static quad. So you're going to push your knee down into the bed, pushing the leg flat. You should see the muscles tense at the front of the thigh. Pull your toe towards you and hold that contraction as long as you can, up to 10 seconds, then relax. And then you're going to repeat that again. So push the knee down into the bed, getting the knee as straight as you can, and relax. Okay, the next one. We start the same. You're going to push the knee down into the bed, get the muscles working. You're going to try and lift the whole leg up off the bed, keeping it straight. Don't let the knee bend, and slowly back down. Relax the muscles and do the same again. Push the knee right down, lock it out straight, lift the whole leg up off the bed. So in this one, you're going to be sitting in a chair, and some exercises again to straighten the leg. So you're going to lift the foot up, lift the leg out straight as you can get it, and then slowly bend it back down. Control it on the way down so you can feel the thigh muscles working. So leg out straight, hold at the top, slowly bend it down. Okay, this next exercise is to help maintain the range in the knee and the movement. So this is seated knee flexion. So you need a piece of kitchen towel or a small plastic bag, something that goes underneath your foot so that it slides easily. So you're going to put your foot on and you're going to slide your foot forwards and then backwards underneath you as far as you can. Keep going as a nice rhythmical movement. You might need to repeat a few so that the knee sort of loosens up and you can increase the range. So this next exercise is to keep the whole leg strong, and it's something you probably do regularly every day anyway, and it's going to be standing up from the chair and slowly sitting back down. When you first start the exercise, you might need to be using your hands to push up gently on the chair. So you put your hands on the chair. You're going to lean forward, bringing your nose right over your toes, and then push up through your legs. Stand up, and then slowly sit yourself back down. If you can manage, you're going to cross the arms over the chest. We're going to stand up without the arms and slowly sit back down. And you could repeat this for as many as you can. So for these next exercises, we're doing it using a kitchen worktop or a stable surface in front of you to help with your balance. So this one's knee flexion in standing. So you're going to bring your heel up towards your bottom, keeping your knees level. Good, and slowly lower back down. We try to keep the knees level, don't let the knee come forward, foot comes up backwards behind. Should feel it working in the back of the leg. The next exercise is heel raises, so going up onto your toes and then slowly back down. Keep going. This is a squat or a mini dip, so use the worktop for some balance, and we're just going to bend the knees, send your bottom backwards and back up. You don't have to go as low as Paul. You can just go as far down as you're able, even if it's just a really small bend. Okay, so this one is hip extension, so working the muscles in the bottom cheek. So use the worktop for some balance, then you're going to lift the leg straight behind you. Now Paul's leaning right forward, and we don't want that. We want the trunk to stay nice and still and just the leg to move. Good, and then bring it back. And repeat again. So you should feel working really hard in the bottom cheek there. It's not a huge range of movement. Turn sideways. Keep the body nice and still. Just lifting the leg backwards, squeezing the bottom cheek, and then relax back. So for this next exercise, you're going to bring the knee up in front of you, bending the knee, and lower back down. Keep your body standing nice and tall. Okay. So this next exercise is hip abduction. It's lifting the leg out to the side. So you're going to lift the leg out, slowly back in. Try not to move the body. Your body needs to stay really nice and still, and just the leg moves. Okay. So get Paul to turn sideways. Do the same again. The body stays really still, and just the leg moves out to the side. You can do this by popping your hand on your hip. So this exercise can help with your balance. So you're going to use the worktop or something to stabilise you. Bend the knees slightly, and then you're going to come onto one leg. If you can let go of the worktop, but you can put your hands down at any point. Moving on to the other leg. See how long you can stand for. Okay, so if you're walking with a walking stick, this is how you would approach going up and down stairs. So you'd walk up to the stairs, make use of a rail if there is a rail. You're going to put your good leg up onto the step, followed by your painful leg or bad leg and your walking stick. You're then going to repeat that for each step, leading with the good leg going up the stairs. It wouldn't matter which side the rail is on, you could switch the rail and put the walking stick into your other hand. So going upstairs, we always lead with the good leg. Paul's going to turn round and he's going to show us coming downstairs. So this is the opposite. You're going to slide your hand down the rail. Going to pop your walking stick down first, and you're going to put your bad leg down onto the step, Use your good leg to lower yourself down. You're then going to repeat this each step. So walking stick, bad leg. Okay, so if you're walking using elbow crutches to help you, this is how you would do the stairs. So you'd walk up nice and close to the stairs. Because we've got a rail, we're going to use it. So you would take the crutch out on the same side, hook it under your fingers on the outside of your other crutch. And then we're going to put the good leg up the step. Then your bad leg, and then you bring the crutch up last thing. Then you repeat that for each step. Good leg first. Good leg, bad leg, crutch. So for coming down the stairs, again we get close to the top of the step, switch the crutch into the fingers on the outside of the other hand. And this is the opposite way around. We're going to pop the crutch down first, then we're going to pop our bad leg down onto the step, use the good leg to lower. And we repeat this for each step one at a time. Bad leg and crutch first, followed by the good leg. Once you're at the bottom, you can just transfer your crutch back into your hand and off you go. So if you're needing to use a walking stick when you're walking to help you because of your knee, this is how you would do it. If your left knee was your painful knee, you would put the walking stick into your opposite hand because we're trying to take load away from the uncomfortable knee. So you'd go forwards with the walking stick first and then your opposite leg. Really take the weight, push down through your hand as you step your other leg through. And repeat the process. Walking stick and bad leg, good leg comes through. Okay, so we've shown you how to walk with the walking aids and we've come outside now to show you if you're out for a walk and you come across a curb or a step, how you would manage it if there's no handrails or anything to help you. So you'd walk up to the step as close as you can. Okay, if you're using your frame, you need to get quite close in your frame because we're going to lift the whole frame up the step. Then you're going to go up with your good leg first. And then bring your bad leg up afterwards and off you go. We'll just show you how to come down that step. So the same thing's going to happen. You need to get quite near the edge, step right into your frame. We're going to move the whole frame down, but this time we're going to come down with the bad leg first. Good, and then you're off to go. So if you're walking outside with your crutches, similar to the frame, we'll show you how to do a curb or a step with no handrail. So you'd walk up nice and close to the step. You're going to step up with your good leg first, leave your crutches down, push through them, bring your bad leg, and then the crutches come up to join you and off you go. So we'll just show you how to come down. So it's the opposite way. So we're going to come nice and close to the edge of the step. The crutches go down first, push through with your hands, bad leg, good leg comes to join it, and off you go. The final useful point to know while you're on the waiting list is that your consultant would like to know if your hip gets much stiffer or your leg gets much shorter. Please ring the number on your appointment letter and let the secretary know. We hope that this video has been helpful in guiding you with some gentle exercises while you await for your surgery. Thank you for watching.